Welcome back to sqadia.com. My name is Muhammad Osama, and today we are going to talk about inflammation. So let's talk about the first step, inflammation, which is the introduction to inflammation, in which we are going to talk about the process of inflammation, the cardinal signs of inflammation, and the causative factors or the causes which results in the inflammatory process. So, introduction to inflammation. What is inflammation? Inflammation is actually the vascular response to injury. It may be because of the increased blood flow, arrhythmia, or because of the different type of blood cells like leukocytes, monocytes, and macrophages, etc., which come into that place of injury or inflammation or infection and perform their processes. And now let's move on to the process of inflammation. So the process of inflammation starts off with the stimulus. That stimulus may be, as I just said, ischemia or injury or infection because of any microorganism like bacteria. And because of that stimulus, the process of inflammation starts. And that process is actually the vascular response by the body. This response consists of the exudation of fluid from the blood vessels, which is followed by the attraction of the leukocytes to the site of injury or to site of inflammation. Those leukocytes or white blood cells, when invade that area, they engulf the bacteria or any other microorganism or the tissue debris or whatever is the causative factor for that inflammation. This then leads to the activation of the chemical mediators, after which there's proteolytic degradation of the extracellular debris. And those proteolytic degradation can be the contents of the cell or from the outside as well. It is then followed by the restoration of the injured tissue, which is very important because the inflammatory process cannot be completed, is not successful if there is no restoration of the normal tissue to its normal structure and function. But this restoration can be limited depending on the extent of destruction and the regenerative capacity of the different type of tissues and cells. So here is a brief overview in a diagrammatic form of the process of inflammation. You can see that the tissue damage causes or results in the release of vasoactive factors, which results in the changes in the blood vessels, like increase in circulation, dilation of the blood vessels, and all of that process. And chemotactic factors, which actually serve as agent which calls on different types of leukocytes and bacteria to the site of injury, which attracts different types of leukocytes. And this results in a local increase in blood flow because of the vasoactive factors and capillary permeability. And because of that increase in permeability, different constituents can leave the lumen of the blood vessel and come into the interstitial area. The permeable capillaries allow an influx of fluid or exudate and cells. So here you can see there are different types of products which are present and different types of cells which are present in the blood vessels, and they are coming out of the blood vessels. It is followed by the phagocytes, which are the cells, a different type of WBCs, which can actually engulf the bacteria or different type of other microorganisms or tissue debris and can digest them. So phagocytes migrate to the site of inflammation via chemotaxis, because chemotaxis happens because of those chemotactic factors which were produced in that tissue. At the end, it is followed by the action of the phagocytes, which is actually the engulfing of the bacteria or the different type of exudates which are causing harm to the body or to the tissue, thus destroying the causative organism or agent which was responsible for the process of inflammation in the first place. Now, talking about the cardinal signs of inflammation, there are 5 cardinal signs: rubor, dolor, calor, edema or swelling, and loss of function. Rubor means redness. Redness, it's because of the dilation of the blood vessels in that area. For example, if there is inflammation of any joint, if you look at that joint would look a little bit of reddish in hue and color as compared to the other body parts or the area of the body surrounding it. Similarly, there is another characteristic feature or cardinal sign of inflammation, which is dolor or pain. Now, why is there pain in the inflammatory process? It is because of the increased pressure, because of a lot of fluid is coming in on that side, which results in increased pressure because of the accumulation of the interstitial fluid. Secondly, it is also because of the chemical mediators such as bradykinin, which may irritate the free nerve endings and thus cause pain. Another cardinal sign is calor or heat. If you inspect the joint or inspect any part which is having inflammation, you would feel that that area is warm as compared to the area surrounding it. And that is because of the increase in blood flow to that area, which is actually the vascular response of the inflammation. Another cardinal sign is the edema or swelling. That edema or swelling is because of the accumulation of the extravascular fluid in that area. And the last is loss of function. So because of pain, because of edema, because of all of these factors, along with that action of the leukocytes and macrophages and monocytes and all of those WBCs. So that area actually loses its function, and if there is not to a very great extent, it is reversible as well. But sometimes it may not even be reversible, depending on the extent of injury or the type of the tissue that is involved. Now, what are the different causes of inflammation? As we briefly discussed in previous slides as well, the causes include infection, which is often manifested with pyrexia as well, which is also known as fever. Then trauma can also result in inflammation, or physical injury. Physical injury like, for example, thermal extremes, for example, a burn injury, which is because of a very high temperature, or frostbite, which is because of very low temperature. So temperature either too high or too low can result in physical injury. Similarly, ionizing radiations, for example, if someone is exposed to a lot of alpha, beta, gamma, or X-rays, etc., they can be detrimental for the body and result in an inflammatory process. Other causes include chemical injury, for example, exposure to acid. Similarly, immunologic injury, for example, if we take the example of rheumatoid arthritis, it is a process in which there is an immune system involved, and there is actually injury. There is no external injury, but it is because of the immunological process that is inside of the body. Other than that, tissue death can also be the cause of inflammation. Sometimes inflammatory changes may also occur in healthy or viable tissues adjacent to necrotic areas, because that inflammation may extend to the other areas which were not involved in the first place. Now, there's a very proper term or a protocol which is known as the Price Protocol. What is Price Protocol? Price Protocol is actually the immediate response of different healthcare practitioners to manage inflammation. It depends on the cardinal signs of the inflammation, and we are actually trying to manage them. Price stands for, P stands for protection, R for rest, I for icing, C for compression, and E for elevation. And protecting the injured area or the inflamed area from further damage is very important and crucial for the healing process, so that the structure can return or come back to its original state of function. So we understand the use of protection, rest, and compression and elevation, and especially if we talk about I, which is the icing, we are cooling the area to actually decrease the vascular response, because as we said that area would also feel warm on palpation or inspection. Similarly, we are compressing that area so that there would be we could manage the swelling or edema which is actually occurring because of the inflammation. And elevation is also to facilitate the blood flow back to the central circulation. So these were the topics that we covered in this topic of introduction to inflammation. Stay tuned to sqadia.com so that you can also visit and learn more about inflammation in the next series of lectures. Thank you very much.